The Johnny Boychuk injury. Why a skate blade to the face is a bad thing. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your #1 source for information on orthopedics and sports medicine that's easy to understand for freaking everybody.
Okay.
You want to know more about my life as an orthopedic surgeon? Be sure to follow me on Instagram or Twitter at Stable Knees. I'm also on TikTok at Dr. Raynor. And if you want to know more about workouts or exercises, or if you're looking for information on injury prevention, be sure to check us out here on YouTube on our sister channel, Human 2.0.
Okay, yeah.
That being said, let's get to the topic of the day. Johnny Boychuk is a defenseman for the New York Islanders NHL hockey team. He was injured 1 week ago on Tuesday, March 3rd of 2020, while playing in a game versus the Montreal Canadiens. So what exactly is it that happened to Boychuk anyway? During the third period of the game at the Barclays Center in Brooklyn, Boychuk was injured in an incident with Montreal Canadiens forward Artturi Lehkonen. Both players were pushing and shoving in front of the Islanders' net at the time of the injury. It appears that Boychuk pushed Lehkonen from behind, causing Lehkonen to lose balance. As Lehkonen fell forward to the ground, his right leg and skate came up into the air behind him. Unfortunately, Boychuk was bending forward at the same time. As Boychuk continued to bend forward, Lehkonen's right leg and skate continued to come up into the air. Eventually, Lehkonen's skate blade caught Boychuk full in the face as Boychuk bent forward. Upon contact, Boychuk recoiled backward. At this point, it was not immediately clear where the skate blade had struck Boychuk. However, he quickly fell to the ground, covering the left-hand side of his face. After a short period of time on the ground, Boychuk got to his feet and quickly skated off the ice. In a replay from another angle, we can see that the skate blade strikes the left-hand side of Boychuk's face in the area of the cheek, and then continues on to strike him in the area of his left brow. The video also shows that this was no glazing blow, as Boychuk's face was struck with some degree of force by the skate blade. After being struck, Boychuk wasted no time in skating off the ice, and in fact, he bypassed the bench and went straight to the dressing room. He was taken to the emergency department urgently, where he was assessed by the attending physician. At that point, we did not yet know what the specific injuries were that Boychuk had suffered. However, it is possible to speculate what might have happened by making some observations of the video. If we look at the video, we can see that Boychuk's face is struck firmly by the skate blade. So we might expect that he may have suffered a laceration or lacerations, as well as fractures of the cheekbones and possibly also the orbital brow. It is also possible that he may have suffered a closed head injury, such as a concussion, as a result of the contact. As Boychuk immediately covers the left-hand side of his face, we are unable to see the exact injuries that he has suffered. However, if we slow the film down even more, we can see that immediately after being struck, there are no obvious facial deformities or alterations of the facial structure as a result of the skate blade blow. This suggests that there are no fractures, or if fractures are indeed present, that they are minimally displaced or undisplaced, basically meaning that the bones have not been moved out of position. In addition, we do not see a significant pool of blood on the ice, nor do we see a significant stream of blood running through his fingers as he skates off the ice. This leads us to believe that there have been no lacerations of significant blood vessels or vascular disruptions as a result of this injury. In the emergency department, Boychuk was assessed by the attending emergency physician. Here, the physician would perform a detailed history and a physical examination. If there were concerns of fractures or associated closed head injury, then Boychuk would have also been assessed with radiographic and possibly even computed tomography imaging, or in other words, CT scan. As with all lacerations, Boychuk would have received tetanus toxoid to prevent tetanus or lockjaw, as well as intravenous antibiotics to prevent cellulitis and or a generalized wound infection. After this, Boychuk would have undergone an irrigation and a debris mop in order to wash the wound and to remove any dirt, contaminants, foreign bodies, or bacteria from the wound itself. Once cleaned, the wound would be closed with sutures or skin glue, depending on the size and the severity of the laceration. If the laceration were relatively minor, all of this could be done in the emergency department by the attending emergency physician. However, if the laceration were particularly bad or involved critical structures such as the lip, nose, or the eyelid, then treatment might require the expertise of a plastic surgeon and or an ophthalmologist for closure and subsequent treatment. So what exactly then was the injury that Boychuk suffered? The following day, on March 4th of 2020, the New York Islanders general manager issued an update on Boychuk's status. He stated that Boychuk had been treated urgently by a plastic surgeon after his admission to the hospital, and that fortunately there had been no significant damage to Boychuk's eye. He stated that Boychuk had suffered an isolated injury to his eyelid that had required 90 stitches to repair. That's correct, I said 90, as in 90 sutures to repair. That's a heck of a lot of sutures for one eyelid. Given the location, size, and the severity of the laceration, the irrigation and the debridement with subsequent suture repair had been performed by a plastic surgeon. When the skin around the eye or the eyelid itself has been cut, typically sutures are required for its repair. When possible, stitches that are near the edge of the eyelid are repaired by an ophthalmologist, a specialist who evaluates and treats eye disorders to ensure that no deformities develop that will affect the way that the eyelids close and move over the cornea or the front of the eye. Other injuries that may require the treatment of an ophthalmologist include injuries that cause the eyes to droop, injuries that go through the full thickness of the eyelid, or injuries that involve the tear ducts on the inside of the eye. Of the lacerations that affect the eyeball itself, most are superficial. Some cuts, however, go through the white of the eye, the sclera, or the transparent dome on the front of the eye, the cornea, thereby penetrating the eyeball's interior. These injuries are technically considered to be a rupture of the globe. A rupture of the globe may also be caused by blunt force. Patients presenting with a ruptured globe typically have decreased vision. The eyeball itself is often visibly distorted and the pupil may be shaped like a teardrop. Occasionally, fluid will even leak from the eye. Excessive bleeding under the conjunctiva, the thin mucous membrane that covers the cornea, is sometimes a symptom of a ruptured globe. Eyeball lacerations can cause serious damage to the structures required for vision and substantially increase the possibility of an endophthalmitis, or in other words, an infection of the eyeball. Lacerations to the globe require immediate evaluation by an ophthalmologist. A CT scan is typically performed to confirm the diagnosis and to rule out the presence of any foreign material inside the eye or the presence of any further damage around the eye. Interestingly, even after all possible medical and surgical treatment has been performed, serious eyeball laceration may still result in partial or even total loss of vision. In rare occasions, after a severe eyeball laceration or after an eye surgery, the other eye may also be inflamed in a condition known as sympathetic ophthalmia, which may result in a partial loss of vision or even blindness of the other eye, the one that was not injured, if left untreated. Fortunately for Boychuk, it appears that his injury involved only the eyelid and did not involve any additional structures. He is expected to recover without any significant deficits after this injury. At this point, there is no timetable for his return. However, as of today, March 10th of 2020, Boychuk has returned to practicing with the team. In a season that seems plagued by this type of injury, this is already the Islanders' third skate blade injury of the season. This involves not only Johnny Boychuk's injury, but also Cal Clutterbuck's wrist injury, as well as Casey Kazika's leg injury. For more on Cal Clutterbuck's injury, be sure to check out my video on this topic. I'll leave a link in the description down below. But even more odd is that this is not Johnny Boychuk's first skate blade injury. Approximately 1 year ago, Johnny Boychuk was injured in an incident when he was struck by a skate blade in the neck in a game versus the Toronto Maple Leafs. Fortunately, in that incident, he suffered only minor injuries, and he was able to return to the game and continue play after being treated in the dressing room. So what does this mean for Boychuk in the future then? In the short term, Boychuk will undergo close observation and follow up with his treating plastic surgeon. His surgeon will monitor him for healing of the laceration and for any signs of developing infection. The suture repair will involve at least some non-absorbable sutures. These will be removed by the plastic surgeon once healing of the laceration has been confirmed. For facial lacerations, this is usually between 7 to 10 days. Once healing of the laceration has been confirmed by the plastic surgeon and an ophthalmologist has confirmed that there are no problems with his eyes or his vision, then Boychuk will likely be cleared to return to training and competitive play. And as has been noted earlier, we can see that already Boychuk has begun to train with the team. In the future, Boychuk might be required to wear additional protective equipment when playing hockey. Despite the fact that Boychuk was wearing a visor, it was still possible for him to be injured by the skate blade since the blade approached from the bottom rather than in front or from the top. Consequently, in the future, a lower visor or additional protection may be required. Fortunately for Boychuk, his injury was not too severe, and it looks as though he will be able to return to playing hockey without any significant problems, making him one of the luckier players this season to have suffered this type of injury. For more videos on injuries that have been caused by skate blades, be sure to check out my videos on Cal Clutterbuck, Tucker Tynan, and Ilya Makayev. I'll leave a link to those videos in the description down below. Be sure to like, share, and subscribe. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.